Hello to all of you, our viewers, wherever you may be around the world. We welcome you to this edition of the News in English on Rwanda Television. My name is Sarishan Hori. As always, we'll begin with the headlines. Ibuka has condemned the ongoing acts of brutality targeting genocide survivors here in Rwanda. The Rwanda Biomedical Center has reported a twofold increase in malaria cases in the country when comparing the first 9 months of 2023 to the same period this year. And on the international scene, two brothers in Kenya are redefining sustainability with eco-friendly durable pencils made entirely from newspapers. Now the details. The Ibuka organization, which advocates for the rights of genocide survivors, has condemned the ongoing acts of brutality targeting survivors in the country. Over the past 3 months, 5 genocide survivors have been killed in different parts of Rwanda. The organization warns that if no action is taken, these incidents will undermine, or rather could undermine, the government's efforts towards unity and resilience. The latest victim, Nduwamungu, a 64-year-old genocide survivor from Rukumberi sector in Goma district, was found dead on Friday, according to Omar Biseruka, the president of Ibuka in Goma. Pauline is the 5th survivor to be killed in the past 3 months, as was highlighted by the Minister of National Unity and Civic Engagement, Dr. Jean Damascene Bizimana, during the 17th Annual Forum of Unity Club in Rwanda on Saturday. In the last 3 months, we have seen examples of locations where killings have once again taken place, targeting survivors of the genocide against the Tutsi, with some of the criminals committing these crimes actually genocide perpetrators who served their time in prison for what they did back in 1994, but did not reform, or in some cases members of their families. In August, there were 3 incidents, with 2 genocide survivors being killed in Nyaruguru district, another in Karongi, and the 3rd incident occurring in Ruhango. As light bearers, we therefore must acknowledge that genocidal tendencies remain in our society, even though the figures are encouraging, and I will give them to you shortly. We must nevertheless eradicate those tendencies completely. Naftala Hishachi, the executive secretary of Ibuka, has attributed these deaths to negligence by local authorities who failed to address reports of harassment against genocide survivors promptly. In most cases, it becomes clear that the victims had in fact asked for assistance prior, and their neighbors had been aware of their predicament. Unfortunately, these crimes are rarely committed by just 1, 2, or 3 people arrested after the fact, but an entire community, because the victims call for help and no one responds. Even those who try to do so are discouraged. Moreover, when a murder is actively taking place, it has been noted that if these acts are not decisively addressed, they could become a significant threat to the unity and resilience agenda that Rwanda is working hard to promote. In his address at the 17th Annual Forum of Unity Club in Rwanda, President Paul Kagame stressed that such actions cannot be tolerated. How can someone be killed in such a way at the present in 2024 during this month because of the way they were created, just as others were killed all those years ago? And we just sit here and accept it as if it is the way it should be. That is not how it should be, especially among a people angry enough to vow that what happened to us in the past must not be repeated. It isn't proper. One of the resolutions from the gathering, Resolution 8 out of 10, emphasized the need to mobilize Rwandans, especially leaders, legal practitioners, researchers, and civil society, to continually analyze how genocide ideology, denial, and trivialization of the genocide against the Tutsi evolve locally, regionally, and internationally, to develop new strategies to combat them. This is part of ongoing efforts to safeguard achievements and continue building the Rwanda the people aspire for. Rwandans have expressed appreciation for how authorities promptly respond to outbreaks, giving priority to the protection of citizens. Meanwhile, the Ministry of Health has noted concrete indications of having successfully contained the recent Marburg virus outbreak. On September 27th, Rwanda announced its first confirmed case of the Marburg virus. Dr. Menelas Cheshimana explained that while the outbreak was severe, health authorities had been prepared for such epidemics. We had conducted exercises focusing on how to treat patients, evacuate them and trace any contacts they may have had with other potential patients and carry out tests. All of that just being exercises. Efforts to identify and test contacts of the infected provided timely treatment and ensured dedicated care by health professionals were pivotal in managing the outbreak effectively. Dr. Ncheshimana shared an example to illustrate these efforts. Individual evacuations took mere minutes, and in cases when it took 2 hours to get, say, 10 people to hospitals, we would strive to halve that time the next time around. Everyone was expected to play their part both quickly and efficiently. Thanks to these measures, it has now been 16 days without any new cases and 12 days since the last patient was discharged. Citizens have commended the government for its proactive approach in fighting such outbreaks. Certainly, the efforts should be commended, the sensitization campaigns on radio and other forms of media. It was very good the way they worked to mitigate its spread before things got out of hand, and we are grateful for that. We know that the illness killed people in the medical profession and are grateful that it did not run rampant in society as a whole. It's good to see that our government is active in such matters when epidemics and pandemics break out, things like COVID. In every instance, the government always provides vaccines and medicines until the outbreak subsides. Hospitals treating Marburg patients have since closed their isolation wards, and all contacts have completed their monitoring period. However, the Minister of Health recently informed the African Centers for Disease Control that in-depth research is ongoing to trace the origin of the outbreak and strengthen prevention measures. In total, the Marburg virus affected 66 people, claiming 15 lives, while others recovered after treatment. Health officials emphasized that the rapid development of vaccines and treatments significantly contributed to fighting the disease. Staying with health matters, in the first year since its establishment, ICAD Africa, the state-of-art surgical training and research center, has significantly enhanced the skills of Rwandan doctors. This advancement is contributing to improved healthcare services for patients across the country and beyond. We have the details with Olive Nete.
In its first year of operation, ICAD Africa has trained 382 doctors from 26 countries around the world through intensive 3 to 5 day surgical courses designed for practicing physicians. This year, the center also expanded its training to include nurses, recognizing their crucial role in surgical care. Dr. King Kayondo, president of ICAD Africa, emphasized that offering these high-quality training programs to healthcare professionals globally is a significant step toward addressing existing gaps in the healthcare sector.
Nous avons pu faire plus de 15 cours.
We have been able to conduct more than 15 courses, and these are courses of a very high level. On the other hand, we are also conducting research on innovative projects. At this stage, we already have a very interesting project. We are working with our French colleagues on a revolutionary ultrasound probe. All these achievements are not just for the country. The benefits or the impact of ICAD Africa's presence in Rwanda extend to the entire African continent. So far, more than 26 countries have sent their surgeons or nurses, not only from the continent of Africa, but also from other countries across the world, like Pakistan and Afghanistan, who have sent nurses for training courses. I believe that ICAD Africa is making an impact not only in Rwanda, but also across the African continent.
ICAD Africa est en train d'émettre, pas seulement au Rwanda, mais aussi sur le continent africain.
Dr. Claire Karitiezi, a neurosurgeon who trained at ICAD's center in France and now serves as ICAD Africa's course co-director, highlights the impact of specialized notes that the skills gained through these courses enhance their expertise, enabling them to deliver faster and more effective surgical care to patients.
Usually mornings are dedicated to theoretical learning, so they are in the auditorium learning about the theory they are going to be practicing later in the laboratory room. And then in the afternoon we have, depending on which domain is being explored, so you may have pigs or some anatomical specimen. So you have maybe 1, 2, 3 days like that, and then you have evaluation every morning and at the end of the day, and an overall evaluation of the course. So of course, having such courses prepare surgeons to be ready before they can go and practice on patient or operate live patient in their own hospitals, because learning in a lab is the closest way to perform surgery in a better simulation scenario. So I'm a trained surgeon, but I still go to courses so I can master some of the new techniques or some advanced techniques. So it's very important for surgeons to do such trainings.
Rwanda aims to become a medical hub for Africa, providing accessible high-quality healthcare services to both Rwandans and patients from across the continent. The establishment of RCAD Africa marks a significant step towards achieving this vision. Dr. Athanase Rukundo, the Director General of Clinical and Public Health Services at the Ministry of Health, emphasized the goal of training every surgeon at RCAD Africa to boost the number of skilled professionals capable of delivering high-quality surgical services across the country.
Going forward, we want to make sure that our training programs, whether it's undergraduate, whether it's postgraduate, I mean specialization in surgeries, we want to make sure that every trainees are passing here to be exposed to these tools, innovations, be part of this research, drive the future we want in this healthcare arena. And it's possible because we have the leadership that has made this possible. We hope that in the near future we'll be able to have almost everyone trained via settings like this one. It's not really only stopping here. We also want to make sure that even the training institutions across the country have access to facilities like these ones.
The Lancet Global Health reports that 5 billion people lack adequate access to surgical services, resulting in 10 million deaths annually due to unmet surgical needs. To bridge this gap, an estimated 1.7 million additional surgical clinicians are urgently required worldwide. Olive Nete, RTV News.
Thank you, Olive. Now, as we noted in the headlines, the Rwanda Biomedical Center has reported a twofold increase in malaria cases when comparing the first 9 months of 2023 to the same period this year, with cases rising from 43,000 to 85,000. The rise in malaria cases is most pronounced in Gisagara district, which recorded 30,000 cases, followed by Bugesera with 9,000 cases, and districts here in Kigali city such as Kicukiro and Gasabo. Despite measures such as promoting the use of insecticide-treated bed nets and indoor spraying, the mosquito population has continued to grow, worsening the situation. Community health workers are playing a vital role in educating the population on malaria prevention and treatment. RBC reported that 2017, that is 2016-2017, saw the highest number of malaria cases in Rwanda, with over 5 million cases nationwide, 18,000 of which was severe, and the disease claimed 600 lives at that time. However, interventions over the years have reduced these numbers significantly, and by 2023-2024, with only 600,000 malaria cases recorded, that is a 90% reduction. 2,000 were severe cases and 67 deaths were recorded, again a 92% reduction. This year, however, there has been a concerning resurgence, with 520,000 new cases recorded in the first 9 months of 2024 alone. The Ministry of Health continues to intensify efforts to address the challenges, especially in high burden areas like Gisagara, Bugesera, and parts of Kigali City. Skol Brewery Limited has unveiled a new logo for its alcoholic drink, Skol Malt, as part of efforts to modernize its brand and align with evolving trends.
We wanted to give an experience. Today, Kigali Universe became Skol Universe. We wanted to give the new energy of Skol Malt with the Keep It 100 experience and the Keep It 100 campaign. It's a new way of talking about Skol Malt. Our brand is renewing. We want to be more modern. We want to be connected to the culture. We want to be connected to the younger generation. And so that's why we chose Kigali Universe, because we think it's the perfect place. We had games, we had basketball match, we had concerts and great beer. And I think we gave the perfect experience to our consumers. And we invite everyone today to start to try the new look Skol Malt. And we know that everyone will love it. Skol Malt, we launched it 12 years ago in Rwanda. So we have not changed anything on the brand for 10 years. So after 10 years, we felt that it needed a new. We wanted a look. So this new look is just to go with the year. Today we are in 2024 and we want to go with what consumer love and what consumer needs, and we believe this new look is really in line with what consumers today are interested about.
Executives have highlighted that the rebranding includes promoting responsible drinking under the Tunywe campaign, encouraging consumers to enjoy alcohol in moderation.
We are drinking responsibly. I think it is very important, especially for the younger generation. The campaign of the government is commendable and we promote it everywhere we do activities. Don't drink and drive is also important. So as a company, as Skol, we support every government effort to make sure that people drink responsibly.
The launch event, marked by vibrant celebrations, featured performances by popular artists such as Riderman, Bushari, B-Tray, Bulldog, Zenotrap, Nessa, Beat Killer, Papa Changwe, Fireman and others. The festival extended through Saturday, delighting fans of the Skol brand and its signature drinks. Welcome back, and now a look at international news. Mahmoud Omari and Rashid Omari, the visionary brothers behind the Momo pencils in Kenya, are redefining sustainability with their eco-friendly, durable pencils entirely made from newspapers. As co-founders, they offer a unique glimpse into their innovative manufacturing process, walking us through the 9 stages that transform newspapers into high-quality pencils. VOA has the details.
When you are done reading the newspaper, Mahmoud and Rashid Omar see a new beginning. The brothers, Mahmoud, an advertising expert, and Rashid, a specialist in clearing and forwarding, retired from their careers to launch Momo Pencils in Machakos, Kenya, where they transform recycled newspapers into eco-friendly pencils, says Mahmoud.
My partner came up with the idea and said that one of my co-founders, he said, you know, we can make pencils from newspapers. And it was a novel idea at that time, and we said, okay, I didn't know it was possible, but after we did our research and everything, we realized it's possible.
After extensive research, Mahmoud and Rashid traveled to China for training and brought specialized equipment needed to launch their pencil-making business. 5 years later, Momo Pencils founder say they can now produce up to 1 million pencils per month. It takes just 2 newspaper pages to make 3 pencils with 0 waste, using a 9-stage process to create the final product.
We paste the insert, we put the lid onto the newspaper, and roll it through the machine. to get the cylindrical shape.
The pencils are laid out to dry in the sun. After drying, they are polished with sandpaper, followed by edge cutting. A finishing film is then applied, adding various appearances. Finally, the pencils go through the last stages of production.
Once we've done that, we go to the next, where we take it to the shrinking machine. Shrinking machine is where you bind the film onto the pencil. From there, we take it for sharpening. Sharpening, and then the last stage is packing.
Momo Pencils employ around 50 people and attracts most of its customers through its official website. Mahmoud says many customers are intrigued by the uniqueness of the recycled newspaper pencils and how they offer from traditional wooden pencils.
The difference is when you look at the aspect of the innovation, which is recycling, we are using newspapers instead of wood. Number two, if you look at the quality, it's long-lasting and durable. And number three is a product made in Kenya.
Despite frequent economic challenges, Mahmoud and Rashid say they remain determined 5 years in to make history with their pencils. They say they hope to build a strong foundation for the future.
Now to the US, where in New York, a media outlet run by immigrants for immigrants is using messaging apps to engage with communities on elections, crime and other local issues. VOA once more.
In a busy street in Chinatown, April Xu heads to her next assignment for the immigrant-focused news outlet Documented. Originally from Wuhan, China, Xu now covers immigrants who, like her, make New York City their home.
Covering some important issues or topics related to Chinese immigrants or Chinese community in New York City.
To connect with audiences, many of whom have limited English, Xu uses the WeChat social media app. It acts as a two-way street, she says.
We communicate with them, and we also, receive input or inquiries from them, which will in turn to inspire us for more content and stories.
Xu also gets out into the community, covering meetings like this one in Chinatown 5th Precinct. Here, residents talk about concerns and receive data on crime.
Public safety or crimes are the top issue they concern most about.
Dedicated coverage for and about immigrants is the mainstay of Documented. The media outlet is run by and for those who make up New York's estimated 3.1 million immigrants.
We pride ourselves at Documented in being able to not just write about immigrants, but to write for them and with them.
Recently, that focus has been on elections. Documented works to bring the national conversation around policy to a local level, all while debunking false claims on the campaign trail.
So we just try and stay focused and consistent in the work that we're doing. We know that the national attention kind of goes up and down, but we really try and maintain our focus and really serve in the communities that we want to reach.
Most of the team are immigrants, so they understand the complexities of issues important to their communities. That was the idea behind the media outlet, says Sidamet. Originally from Sudan, he worked for mainstream media before helping found Documented in 2018.
One of the areas that was a bit different, that we actually wanted to do differently to how we'd been reporters previously, was that we wanted to actually create immigration reporting and news generally for immigrant communities, not just about immigrant communities.
To do that, Documented turned to the social media apps most used by the communities they cover to share content in English, Spanish, Mandarin, and Haitian Creole. Sidamet says their audience wants to be seen in the news in a positive way, and Documented helps them be seen and heard. With Liam Scott in New York, Cristina Caicedo-Smith, VOA News.
Now, before we go, let us once again take a look at the headlines that made up this edition. Iwokas condemned the ongoing acts of brutality targeting genocide survivors here in Rwanda. The Rwanda Biomedical Center has reported a twofold increase in malaria cases in the country when comparing the first 9 months of 2023 to the same period this year. And on the international scene, two brothers in Kenya are redefining sustainability with eco-friendly, durable pencils made entirely from newspapers. It's always a pleasure when you're able to join us, and I hope you'll continue doing that. I'll be seeing you soon again. Goodbye.